Hello dear patients, let's talk about the scar management. Scar is a product of your healing mechanism after a tissue injury. When your tissues are injured, the healing process starts immediately and the healing ends almost like 1 year after your injury when the scar becomes totally mature. So there is not a scar-free surgery. Anyway, if you have a surgery, if you have a cut, then you're going to have the scar. But of course, you can minimize your scar. So let's talk about how to minimize your scar. There are 3 factors that affect your final scar. First one is the tension on the wound. Second is the aftercare. Third is the genetic that you cannot change. So let's talk step by step. The first factor is the tension on the wound. The tension is decided, of course, in your surgery by your surgeon. Anyway, even we do a breast surgery or a tummy tuck surgery, we cut some skin and we connect tissues together. So if there is a big tension between the wound edges, it's going to be separated and you can see like a separation or sometimes a thicker scar or a bad scar. So the healing, the first important point about the healing, about the scar management is the tension on the wound. Of course, about your surgeon's technique, surgical maneuvers, or some devices or tools that you use for stitching. Anyway, there are some factors also that affect this healing process as well, like extra liposuctioning, extra swelling, or extra hematoma or seroma behind the tissues is always going to give extra tension on the wound edges and it's going to heal with a thicker scar, of course. The second part is the aftercare and it's in your hands, of course. The first few weeks, the first 2 weeks after your surgery, your scar line is going to be closed by like a tissue glue or a strip or a kind of extra dressings. They help the skin to attach together and they are trying, of course, to reduce the tension on the wound edges. So the first 2 weeks is the early post-op period. You're going to have some strips and some tapes and you cannot do anything right at the moment. But like 2 weeks after, the surgeon, of course, will going to remove your tapes and the skin, you're going to see directly the skin, and you can also now start the management after the 2 weeks of your surgery. So what you're going to do is, I usually recommend for my patients 2 weeks after surgery, they first start with the moisturizing the skin, and it's going to help the epithelialization of the skin edges. So the first 3 to 4 weeks, you always focus on moisturizing the skin. You can use any bepanthen creams, you can use the Vaseline creams, you can use some ointments. That's all okay. Just the main issue is to moisturize the skin and give a better healing for the skin. So when it's over like 3 to 4 weeks after your surgery, like a month after your surgery, then you can add something extra for the scar treatment. It's the silicone. You can either use some silicone gels, you can use some silicone sheets, silicone tapes, or you can use both together. Silicone is a kind of material that's scientifically improved that silicone helps the skin to reduce the redness, to have like more flat surface on the scar, and it helps the maturation of the scar. So silicone is one of the most important tools for us and for you for the aftercare. And these silicone tapes can be used either to 6 to 9 months after your surgery, and it's going to help a lot about your maturation of and remodeling of the scar. After also, additional to these scar therapies, we can also do some extra micro needling for the wound edges or wound scar corners. It helps the contraction of the scar and it helps to have like a small scar with some micro needling or a carbon CO2 fractional laser. Also, this laser improves the scars a lot. It changes the color of the scar and it helps about the remodeling of the scar and maturation of the scar a lot. So you can use all these possibilities for the aftercare as well. And this is going to give you the final result. Like 1 year after surgery, you're going to see the mature scar and you're going to see the final result. Of course, there is the third option, third factor, for the scar management. It's your genetic that you cannot change, or the surgeon cannot do anything for your genetics. Even some people, even you do the best, sometimes you see like atrophic scars, red scars, hypertrophic scars, or keloid scars. They are all about your body's healing type. So when you finish these all factors and when you finish all this aftercare, if you still have a big scar or if you still have like an hypertrophic scar, there is still a chance you can just consult your surgeon. Sometimes because of the surgery, because of the liposuctions, additional swelling, the tension on the wound is a lot and you see some ugly scars, even you do your best. So first, like a year after your surgery, you can try to have a scar revision surgery. The advantage is this: you cut the skin, you don't do any liposuction, you don't give any extra tension, and the skin is going to be loose enough. So when you skin the wound edges with a low tension, it improves the skin's quality. So even 1 year after your surgery, you can still try to have a revision surgery and you can have a better scar. But even with these all maneuvers, if still not healing nice, so maybe it's your genetic and that's the maximum scar that you can have. Just don't forget that there is no surgery like scar free. You will always have a scar, maybe minimum, maybe maximum, but there is always a scar. See you in the next video.